Welcome back to Headline to Heartline, where we take the news that matters most and make it personal. Today, our deep dive is all about navigating Medicare changes for 2025, custom tailored to help you understand what's coming and what it truly means for your financial well-being. Let's consider someone like our listener, Maria, who relies on several prescriptions. We'll trace how these new Medicare changes could dramatically impact her and perhaps your situation.
And this truly is a critical window for review. The Medicare open enrollment period runs from October 15 to December 7, 2025. Even if you're happy with your current plan, these are some of the biggest updates in years, making a thorough review absolutely essential.
Okay, let's unpack this, starting with some of the basics you'll definitely notice. For 2025, the Part B monthly premium is set at $185.
Right.
Which is up a bit from $175 last year. And your annual Part B deductible will be $257, an increase from $240.
Yeah. So these are, modest, but definitely noticeable increases to your out-of-pocket costs.
Definitely noticeable.
But what's fascinating here is where the significant changes to prescription drug costs really kick in. Beginning January 1, 2025, your out-of-pocket drug costs under Medicare Part D are capped at $2,000 per year.
Wow. Okay.
Once you hit that cap, you pay nothing more for covered prescriptions for the rest of the year. This isn't just about saving money. It's a fundamental shift, transforming Medicare Part D from a potentially unpredictable financial risk into a truly capped, budgetable expense.
A budgetable expense.
For many, like our listener Maria, this means finally having peace of mind they've never had before.
A $2,000 cap on drug costs?
Yeah.
Expert, this is a change many have been hoping for. So the infamous donut hole is truly gone.
Exactly. The donut hole as we knew it is indeed gone.
Okay.
Bringing much needed predictability.
And does this shift in risk for the insurers mean we might see changes in other areas of plans, perhaps? A slight adjustment in premiums or maybe fewer extra benefits for some plans?
That's a really good point. While the $2,000 cap is, largely celebrated, policy experts like KFF do caution that this shift in liability might subtly lead some insurers to offer fewer premium-free Medicare Advantage plans.
Oh, okay.
Or slightly higher deductibles in other areas. It really underscores why their shop carefully message is so crucial this year.
That's a vital nuance.
Yeah.
What else should we know?
Well, there's also another new tool. The Medicare Prescription Payment Plan. This allows you to spread your drug costs evenly across the year in monthly installments.
Oh, like a payment plan?
Kind of, yeah. Much like a payment plan for a car, but for your medication.
I see.
While it doesn't reduce the total amount you owe, it certainly aids in budget management. And what's often overlooked is that this plan could be a lifeline, not just for those struggling now, but also as a proactive buffer for unexpected high-cost medications later in the year.
A buffer.
It's about preventing financial shockwaves, not just smoothing existing payments. Just remember, you must opt in with your specific plan to use it.
But for some, another payment plan might sound like, more complexity. What are the common misconceptions or potential downsides people should be wary of beyond just needing good record keeping?
Right.
Is there a risk of missing payments, for example, and what happens then?
That's a great question. Pharmacies and insurers, while largely welcoming the monthly payment plan, are indeed urging beneficiaries to manage payments diligently. Now, while your Medicare coverage itself cannot be dropped if you fall behind,
Okay, that's important.
your plan can remove the monthly billing option, potentially creating a lump sum burden for you later in the year if you haven't kept up.
Right, so you'd owe it all at once, potentially.
Yeah.
Okay, so what does this all mean for you right now? We have 3 key actions for you to take. First, watch your mailbox and don't just toss it with the mountain of coupons.
Yeah, right.
Your plan's annual notice of change, or ANOC, must arrive by the end of September.
The ANOC, yeah.
This letter details next year's premiums, deductibles, drug coverage, and pharmacy networks. This ANOC letter is arguably more important than finding a $1 off coupon for your favorite cereal this month.
Absolutely.
Because it truly dictates next year's healthcare budget. If you don't get it, call your plan.
Definitely call.
Second, prepare your information. Make a list of all your medications, your doctors, and your preferred pharmacy. Having this ready will make plan comparison much easier when you're looking at your options.
It really does speed things up.
And third, know where to get help. You can call 1-800-MEDICARE or your local state health insurance assistance program known as SHIP.
SHIP, yeah, for free, unbiased assistance.
Exactly.
And, if we connect this to the bigger picture, it's clear these changes are viewed from several angles. Advocates for seniors like AIRP are unequivocally celebrating the $2,000 cap.
I bet.
As AIRP highlighted in their recent press release, The impact of this is truly staggering, projecting savings of over $1,000 yearly for many,
Over $1,000.
especially those with high-cost prescriptions for chronic conditions like rheumatoid arthritis or multiple sclerosis.
Understanding these broader implications makes your next steps even more crucial. Remember that critical open enrollment period, running from mid-October to early December.
October 15th to December 7th.
Right. Any changes you make during this time take effect January 1st, 2026. This is definitely a year when it's vital to take a closer look, even if your current plan carries over. Expert, what are your top smart shopping tips for navigating this period?
Absolutely. First, check if your specific medications are covered at good prices in the plan's formulary.
The formulary.
The drug list.
That's the one, yeah. The official list of drugs your plan covers and the prices they've negotiated. Second, compare total costs. Don't just look at monthly premiums.
Right, not just the premium.
But factor in deductibles and copays. A lower premium might come with higher out-of-pocket costs elsewhere.
Makes sense.
And third, consider carefully if the new monthly payment option truly fits your budget management style. Good point. And a crucial warning we always emphasize. Watch out for scams.
Oh, definitely.
Medicare will not call you out of the blue to sell a plan. If you're ever in doubt, hang up and call 1-800-MEDICARE directly.
Best advice right there. So the bottom line for 2025 is clear. Modest premium increases, a game-changing $2,000 drug cost cap.
Game-changing, yes.
The donut hole is gone, and a new payment plan option. Reviewing your coverage during open enrollment October 15 through December 7 is your best chance to save money and gain peace of mind. As you review your options this year, remember, these changes aren't just about saving money today. They're a signal of a larger shift in healthcare policy, pushing towards greater predictability and patient protection. The real question is, how will this new landscape empower you to advocate for your health in ways you couldn't before?
That's a great question to leave folks with. Thank you for listening to Headline to Heartline. If this episode helped you understand what's changing in Medicare, please subscribe to our YouTube channel and give this video a like. It helps us keep bringing you clear, trustworthy news from the headline to the heartline.